When you lie down flat on a table in a supine position, so everything is facing up, so here's the head, it's facing up, you generally think that the body is straight, but that's because you're looking at compensation. You're not looking at the true picture of how the body is actually laying. And so when we talk about the left AIC, right BC, right TMCC pattern, this video, what I'm going to show you next, is essentially what you would see if the body was not trying to stay straight on the table. You'll notice that everything is oriented to the right, but when you look at someone, because they have skin and muscle and everything on top of these bones, if you were just looking at the bones, the following video, the next part, is what you would actually see. And you can't really get a good view from this angle, so I'm going to actually stop it and walk around with it and you'll see it better. So this is what you're really looking at when someone lies down supine on a table. You have a pelvis oriented to the right, so you'll see the left ilium, this is the left side, is orienting the entire, is coming forward and orienting the entire pelvis to the right. The sacrum is also oriented to the right. That will also mean the lower vertebrae, so sacrum, then L5, L4. I don't know if this model is lacking some vertebrae, but they're also oriented to the right. The left side is forward compared to the right side. When you move yourself up into the rib cage, the rib cage is on the right side, is laterally flexed, internally rotated. I can't do that with this model, but these ribs are down more, so there's not as much air on that right side. And these intercostals on the right side are all squished together. So you have tight rib cage on the right side. On the left side, you have a rib flare. These left ribs are externally rotated, they're moving up, and there's a lot of air in this area, and it's moving away from the left pelvis. So on the right side, you have the right rib cage and the right side of the pelvis moving closer together. On the left side, you have them moving further apart. And this area is that left ZOA that we're always talking about. This is where the left obliques are internal obliques are so important. Through exhalation, brings the ribs and the ribs on the left and the pelvis on the left closer together. So exhalation closes everything when you're on your left foot. Okay, as you move up, and again, you see the spine, it's actually oriented to the right. And then it starts to come back towards the left, up above this area. It starts to counter-rotate back to the left in order to stay straight. And then unfortunately this is the base of the model and I can't take it off. The neck, you have a cervical spine. The neck is also oriented to the right. I can't do it here, but in order to stay straight, it would also side bend to the left. So it's going to orient to the right, and then it side bends to the left to stay straight. So if I exaggerated it, whoops. If I exaggerate it, so we have a cervical spine that's oriented to the right. If this pole were in here, it would have to stay straight, so this would be straight, it would have to side bend to stay straight, and that's what it's doing, but I can't make that happen on this. And then you have the head, in order to stay straight, because this would be the normal position of the head, it would also be off to the right, it has to counter-rotate back to the left. So when you are lying flat, you think your head is like this, but it's only in this position, this straight position, because it's turning to the left. Left to its own devices, when I do a test and I show limitation of the neck's ability to bend, it means your head is actually sitting in this direction in neutrality, but to stay straight, it turns back to the left. So this would be an example of the left AIC, right BC, right TMCC pattern as it would be seen on a table without compensation. But because there is compensation, everything looks straight when you lie down.